This is the continuations of the report about injuries to the lower leg, ankle, and foot can vary widely in severity and time. Here are some common ones about my report is all about vascular and neural disorder. First, we have let's proceed to what is mean vascular. Vascular is refers to anything related to blood vessel, which are tubular structures that carry blood throughout the body. The vascular system and consists of the arteries, veins, and capillaries. It is part of our injuries to the lower legs and ankle and foot. Let's proceed for the next is kung saan ba natin matatagpuan yung vascular. And we have arteries, then we have veins and capillaries. Last, vascular to the arteries carry oxygen, rich blood away from the heart to the body's tissues and organs. Another is from the arteries. It is providing them with essential nutrients and oxygen. For the next is veins. Veins, on the other hand, transport oxygen depleted blood back to the heart to be pumped to the lungs for the oxygenations. And we have capillaries, are tiny blood vessels that connect arteries to veins, facilitating to exchange of gases, nutrients, and waste product between the blood and surrounding tissues. Next, we have vascular disease or disorder involve abnormalities or damages to the blood vessel, which can affect their structure, function, or both. We have example of vascular diseases include peripheral artery disease or PAD, deep vein thrombosis or DVT, and varicose veins, aneurysm, show peripheral venous and disease, and vasculitis. I have here pictures about the symptoms of the peripheral arterial disease. This disease or PAD is condition caused by atherosclerosis, which is the buildup of plaque in the arteries leading to narrow or blocked arteries. Symptoms may include leg pain or cramping, particularly during activity. It can progress to more severe symptoms such as pain at wrist, non-healing bones, and tissues loss. In the deep vein thrombosis or TBT, it is the formation of blood clot in a deep vein obtained in the legs. It can cause swelling, pain, or and redness in the affected leg. It clot break loss and travels to the lungs. It can cause a pulmonary embolism, which is a medical emergency. Pag nagkataong meron kayo nito. I have here that consider examples of vascular injury involving to the lower leg, ankle, and foot. Some of example is arterial trauma resulting from a lower leg fractures. Here is scenario. John is a 40 years old construction worker fell from a height at a construction site and sustained a compound fracture of his lower leg bone or tibia. The fracture resulted in significant trauma to surrounding tissues, including the arteries supplying blood to the lower leg, ankle, and foot. The symptoms of the vascular disease is about my example or the scenario about Chan is upon assessment by emergency medical services, Chan exhibits signs of arterial injuries, including severe bleeding from the wound, loss of sensations or tingling in his foot, and a pale, cold extremity below the fracture site. These symptoms suggest compromised blood flow to the lower leg. Let us proceed to the next is the new Neural disorder meaning, it also known as neurological disorders, refers a broad category of medical conditions that affect the nervous system, which means is ibig sabihin ng broad category, it is our brain na that means is the neural disorders is will affect our brain and our nervous systems, and our nervous systems include the brain, spinal cord, and peripheral nerves, which is together control and coordinate body function and communication between different parts of our body. That means of our neural disorder, if they are not really function, which is our body is our brain will, will parang nakokontrol yung body natin. So, dapat yung brain natin is maayos and saka magpapalo yung ating body. Neural disorder, it encompasses a wide range of conditions affecting the nervous systems, including the brain, spinal cord, and peripheral nerves. Here is our example of neural disorder that can impact the lower leg, ankle, and foot. Next, I have here the examples of neural disorder. Neural disorder is which is we have peripheral neuropathy, charcotic marie tooth disease or CMT. Next is sciatica, and next we have arterial disease or PAD, multiple sclerosis (MS). Next is Guillain-Barré syndromes or GBS, and next neuromuscular disorder. We have sa peripheral neuropathy. It is refers to damage to the peripheral nerves, which can cause symptoms such as numbness, tinkling, weakness, and pain. The extremities, it can be caused by various factors, including diabetes, infections, autoimmune disease, and exposure to toxins. And we have trichotic marie-tooth disease or CMT. It is a group of inherited neurological disorder affecting the peripheral nerves. It can lead to weakness, muscle atrophy, and sensory deficiency in the lower legs, ankles, and feet. Foot deformities such as high arches or erythemus are common in individuals with CMDH. Next, we have neurological. As we have sciatica, it's a type of radiculopathy that occurs when the sciatica nerves, which is run from the lower back down to the back of each leg, becomes compressed or irritated, and it can cause pain, tingling, and numbness that ranges from the lower back down to the buttocks, thigh, and legs, affecting the ankles and feet. In peripheral arterial disease, it is a vascular disorder characteristic by narrow or blocked arteries in the legs, leading to reduced blood flow to the lower extremities and advanced stage or PAD. Same with neural disease, and can cause symptoms such as leg pain, cramping, numbness, and non-healing wounds in the feet, ankles due to inadequate blood supply. We have multiple sclerosis is a chronic autoimmune disease that affects the central nervous system, including the brain and spinal cord. Depending on the locations of in the nervous system, if individual with MS may experience symptoms such as weakness, numbness, tingling, and coordination problems that can affect mobility, sensations in the lower legs, ankles, and feet. Okay, the treatment of the neural disorder is affecting the lower leg and ankle and foot barriers depending on the specific conditions of and it is underlying cause. It may include medications or physical therapy orthotic devices, assistive devices, surgical interventions, and lifestyles modification to manage symptoms and improve quality of life. Early diagnosis and multidisciplinary management are essential for optimizing outcome and preserving function individual with neural disorder.